Now, January is officially National Glaucoma Awareness Month. Now, during this time, it is so important to spread the word about this group of diseases that affects more than 3 million Americans every single year. I got to catch up with Dr. Goldhair from Icon Eye Care in the sponsored segment to learn more about glaucoma, how to prevent it, treatment options, and so much more. Check it out. Today we are at Icon Eye Care. I'm actually sitting next to Dr. Goldhair, and we're talking about National Glaucoma Awareness Month, right? It's actually the month of January. That's the topic of conversation today. So, Dr. Goldhair, could you tell us a little bit about glaucoma? What exactly is it?
Glaucoma itself is a disease of the retina. The retina is the nerve that lines the inside of the eye. And essentially, glaucoma means your retina dies faster than you do. And in that, your peripheral vision starts to tunnel in and tunnel in and tunnel in until you could potentially lose it all. Now, with that being said, most people don't go blind with glaucoma because we find them, we treat them, we prevent it from getting worse. But there are plenty of people that have not been checked that will randomly show up with loss of vision and we can't bring back what's lost. So very important thing to get checked on a regular basis every year because you never know when things are going to come up like that.
Absolutely. Yeah. So preventative measures, something you can absolutely take if you do get that. Is it an eye exam every year?
An eye exam every year, definitely. Risk factors for glaucoma, family history. If anyone in the family has glaucoma, you absolutely should be checked once a year. As you get older, it's definitely more prevalent. I mean, let's face it, you know, we like to age like wine. It doesn't always work that way.
Yeah.
High eye pressure, of course, you wouldn't know unless you were being checked. So high eye pressure is a big one. However, you don't have to have high eye pressure to have glaucoma, which is kind of confusing for people. But that is actually what we treat with glaucoma when we do find it, is decreasing the eye pressure or the stress on the eye as much as possible, even if you don't have that risk factor. Other risk factor, it is more prevalent in African American and Hispanic populations. So good thing to be checked there as well. There are secondary glaucomas that aren't necessarily hereditary. So if you have diabetes, especially very uncontrolled diabetes, very important to get checked. Because you can get blood vessels that grow where they're not supposed to, and it actually clogs up your drainage system, and your eye pressure does go sky high sometimes. It can be very painful. You know, other things, you can have high blood pressure that can cause a similar thing because these are affecting the blood flow systems of the eye, and so your eye responds by making these abnormal blood vessels that just block things. So definitely, if you have those risk factors, if you have lots of medical issues, you just don't even think about the eyes. It's kind of the last thing on your mind when you're trying to get your body kind of equilibrated with blood pressure and diabetes and such, but eyes are so important.
And would you say glaucoma can kind of be like a silent killer in a way?
Absolutely.
Some people may not get those symptoms until later on in life, and like you said, once your sight is gone, you can't get that back, right?
Oh, absolutely. That's the problem with glaucoma, quite honestly. So even if your pressure elevates, there are instances where it elevates suddenly and the pressure really is painful. And so that indicates, of course, someone's obviously going to come in if they're in pain. But when it slowly goes up, the eye gets used to it, and so you don't have those pain symptoms. So it gets used to it, your nerve starts dying on you, and what brings you in is the fact that you've lost vision.
Okay. There you have it. So throughout the month of January, right, is there anything you guys are doing here at Icon Eye Care to bring people in to get those tests just throughout the entire month? Or it's not just a month thing, it's every
We're
single
always
year.
trying to do that. We're always trying to promote eye health. You know, we do extra clinics on occasion for glaucoma screens. But, you know, it's always a good idea to have your eyes and forefront.
All right, thank you so much for teaming up with us today.
Sure.
We appreciate you, Dr. Goldhair. You guys, Icon Eye Care, right here in Golden. All right, well, Icon Eye Care actually offers comprehensive eye care, LASIK, vision correction, and cataract procedures in Denver, Lone Tree, Golden, Westminster, and Loveland. These guys are absolutely everywhere, and they're here to help you out. To learn more, give them a call at 720-524-1001 or visit them online, iconeyecare.com. We want to say thank you again to Icon Eye Care and, of course, Dr. Goldhair for sponsoring this segment.